This month marks Minority Mental Health Awareness Month.
NBC5's Sid Boulay is live in the newsroom for us this morning. And Sid, you spoke with Vermonters working to heal trauma.
I did, Sarah Beth Zuri. Dealing with everyday stress or trauma can be very painful. But one state official says learning how to process it leads to living a healthy and fulfilling life.
So my father passed away about 6 weeks ago. He passed away at the age of 79.
Kaya Ganguly says her father's age at his time of passing is not normal for his family who live in India.
My father came to this country in the 60s and lived and worked here and died a good 20 years earlier than anyone else in his family.
Ganguly says trauma like this affects people all the time, but some carry a larger burden than others.
Particularly when you're looking at people who are members of the Black, Indigenous, or people of color groups, you're dealing with an added layer of mental health stress as well as racial trauma.
Many of us have been harmed when seeking care.
One UVM health clinical psychologist says we need to break down the stigma around mental health.
We don't stigmatize going to your PCP for your physical health, or the dentist for your dental health, or even for those that practice a faith or spiritual tradition, going to your religious or spiritual leaders, right, for your spiritual health.
To really thrive and be resilient, which doesn't necessarily mean that you bounce back, but rather that you can bounce forward.
Whether you meet with a provider in person or virtually, Dr. Marissa Coleman says when it comes to investing in yourself, you can never go wrong. But it's not the only option. You can also care for those in your community.
By doing so, we strengthen ourselves, we strengthen our friends, our family, and our communities, and end up with much stronger and better health outcomes.
Instead of asking, how can I help? Ganguly recommends taking small actions like cooking a meal to share with neighbors or babysitting for friends. All things she says can make day-to-day life a little easier. Ganguly says daily life can take a toll on everyone, whether you're dealing with trauma or not, something that impacted her father leading up to his passing.
It was, I really believe, just the stress of daily life in this country really took a toll on his health.
If you or a loved one are seeking help, reach out to your provider or call the 988 hotline if you're in a crisis. Reporting Sid Boulay, NBC5 News.
And there are also mental health resources available across our region. If you need to chat with someone, you can take a look at your screen. In Vermont, you can text 741-741 and type in VT to get help. In New York and New Hampshire, there are also helplines available to call or text 24/7.